Thank you for joining our Social Justice and COVID-19 online event. We are asking you, please, if you have some computer speakers problem, please go to your chat and then you have somebody that will help you. I want to let you know that this event is recorded and will be posted on August 24th in our website. Please go and visit us. And also, after this event, you will receive in your email one follow-up email, and please answer the survey. I just want to say thank you and introduce to you our presenters and the facilitators. Today we will be talking about sharing our experience, lived experience in COVID-19. This is a roundtable. We will talk about social justice in COVID-19. This event is sponsored by Samsung, and we are the Mental Health Justice Technology, and we are partnered with Yale, Program for Recovery and Community Health, C4 Innovations, Hartford University, Department of Psychiatry, and Center of Education and Improvement. Our mission at this grant is to disseminate evidence-based practice across the New England. And our focus is recovery-oriented practices, including recovery support service with the context of recovery-oriented system of care. And my pleasure today to present to you Pauline. She will be the facilitator and she will introduce the presenters. Thank you so much, Pauline. Welcome.
Hello. Good afternoon, everyone, and welcome to the last of a series of 3 webinars called Sharing Our Wisdom, Lived Experience, and COVID-19. So the Wisdom Project was made possible by a partnership between the Yale Program of Recovery and Community Health and the New England MHTTC. And it is led by Florence, who is here with us today as a presenter. We'll bring you a series of 7 podcasts and 3 webinars where we talk about mental health, social justice, equity, and COVID-19. The question that motivated this series is, what can people who have had mental health challenges uniquely offer by virtue of their life experience of recovery? This entire project was organized and invites people with lived experience with mental health and or substance abuse challenges. We want to share our wisdom on what has helped us in these difficult COVID-19 times. So we will monitor the chat for questions through our webinar, and we will have time at the end to take your questions. And so it would be really great if we could engage with us. If you could engage with us. And before starting, I would like to take a moment to first to thank Anna for putting this project together. We've been working for now, like, I don't know, maybe three months from it, basically since the beginning of the pandemic. And she's been a wonderful leader. And then our program director and New England MHTTC director, Larry Davidson, for his support. And then other colleagues who've made this work possible. So just to name a few, Thomas Wexler, Caribbean, Kendall Atterbury, and Caris Marek, and many others. Without their energy and support, this wouldn't be possible. And so without further ado, I'd like to introduce our panelists for today's conversation. I have the honor to be colleague of these 2 powerful women, and I feel really privileged to be facilitating this discussion today. So first, Bridgett Williamson. She's the co-director of the Citizens Project in New Haven, Connecticut for the Yale Program for Recovery and Community Health. We worked together for 3 years. She has worked in the field of peer support for Columbus House, first in New Haven, Connecticut, and she's been at Perch since 2007, starting as a casual employee and then expanding her work to become a research assistant. Her contribution to the work of citizen-oriented care, community organizing, and peer support has influenced the field nationally and internationally. She's been presented also in Montreal and in Glasgow. Anna is a Ph.D. in clinical psychology. She is a postdoctoral associate at the Yale Program for Recovery and Community Health. She is interested in the open dialogue approach and the intersection between human rights and mental health. And finally, I just wanted to acknowledge the fact that the third panelist was supposed to join us today, but they couldn't make it. And I just wanted to say that they will be missed. And so maybe we could start by the first question. Maybe if Anna or Bridgett wants to start of what was your experience when COVID hit? What did you experience?
Bridgett, did you want to get us started?
Yes, Anna. Hi, my name is Bridgett. Can you guys hear me?
Yeah.
Okay, so what I do when COVID-19 hit, it was like a life interruption because I really didn't know too much about COVID-19. So I knew that I had to end the group, and we wasn't able to come back to work. But the whole time since COVID-19, since March 19th, I had literally been in the community, been out here in the streets. So I have been out here and watching all the disparities. So what I was doing, trying to get my needs met and trying to help other people get their needs met. That's what I was doing on Pauline.
That's great, Bridgett. I think that a lot of our conversation today is going to maybe revolve around contrast. We've been talking about this and been planning for this webinar, and when talking to different people about how COVID affected them, we quickly realized that this is affecting people in incredibly different ways. I'm originally from Brazil, so I'm not a citizen of this country, and I was recently diagnosed with a serious physical illness, and one of the treatments that I had to do was a treatment that completely destroyed my immune system, and that's when COVID hit. So I experienced it with a lot of fear regarding my previous condition, and then just not knowing anything about this virus, as no one did. But I was immediately able to start working from home, and I have been working from home, and I barely have to leave the house. So that already is something that to me strikes me as very different from, let's say, folks who don't have the option to stay home, folks that actually have to go to work in order to put food on the table, folks who don't have a car and need to go get groceries and take the bus, people who are working in essential services. And so already we started seeing very early on how differently this has affected different people. So I think that in one way, I guess we're all experiencing some of these things together, like the fear, the uncertainty, and all of that. And in some other ways, we are having dramatically different experiences. And I'd like to acknowledge that since they started collecting data on outcomes related to COVID infections, we could immediately see that people of color and Latino populations were getting way more affected than white folks. And so that started very early on. And we're kind of here to provide, I guess with our story, some of these contrasts.
I was on that, Bridgett. I was thinking about these long description that you were doing during the beginning of the pandemic about just people mainly in the street, but other, like more generally people sleeping in shelters or people just struggling to get their needs met. And so you've talked at length about just people that basically you couldn't stay in, that you had to go out and help them, not only for yourself, but also for them and for your community, that it was not an option for you to stay home. And so I was wondering if you could talk a little bit about that.
So again, Pauline, I was one of the people that didn't get their needs met because when COVID-19 hit, I didn't have toilet tissue. I actually moved in with my two sisters, and with my grandbaby, and we didn't have toilet tissue, so I had to come out like literally for the first 3 weeks. And what I did notice that when I was going out to look for toilet tissue every day for the 3 weeks, I was noticing that people in my community were struggling also trying to get their needs met. I'm trying to get chicken. Like at one time there was no chicken on the shelf nowhere. So not only did we didn't have the necessities that we needed to stay in the house with, but we also didn't have food also along with that. So people had to come out. But what I was noticing, people still out here in the street, people still was looking for food, people still looking for drugs. Like because COVID-19 hit, life still went on. People still was having to struggle, and I'm like Anna, it was a blessing that I was able to stay home with pay, but that wasn't enough because all the money in the world wasn't helping lift my community up and trying to keep them hopeful. So, it was really mind-boggling at first when COVID hit, and again, I am in recovery from heroin and cocaine, and I've been clean since 91. So when this hit, I didn't know what to do, where to go. All I knew, Trump and them kept saying, stay in the house, but my needs wasn't getting met, so I couldn't stay in the house, unfortunately. I hope I answered your question.
And I'm sorry, I have like a lot of noise around me. I thought that there was going to be quiet, so I hope that it's not too bothersome. I'm sorry. But maybe another thing is that when we prepared for this webinar, when we prepared for this webinar, you mentioned that it's crazy, I'm sorry, and that you and a lot of people around you have been frustrated and angry, and that on the day-to-day basis, you're already surrounded by violence on a day-to-day basis. And it's something that by working with you, I really understood better, that you move into the world having a very different experience. And one of the reasons is the police, and the other one is just day-to-day violence. And you've noticed that that there've been more violence than usual. And just people are angry and tired and frustrated, and it's just, wanted to know if you could talk a little bit about that.
I think you have to unmute yourself, Bridgett.
Thank you. I sure was.
That's perfect. Thanks.
I'm sorry. I was walking to the store, and I seen a young man laying on the ground over here on Digital Avenue outside, and I happened to walk back by it, and I knew the young man, but he used to be a drug dealer that got shot. He's like paralyzed from the waist down, and he's like in a wheelchair, and he was living outside, and so I went I walked up to him and I asked him, man, what's going on? Why are you out here? I don't have nowhere to go. COVID-19 shut everything down. Not only did it shut people's jobs, but halfway houses were closed. The shelters were closed. People were, being put in shelters and wherever they could stick them at. But if you didn't have a red tape, and what I mean by that, if you didn't have a paper trail behind you, you was, left out here in the street. So this young man stayed outside in the rain, sleet, and snow. I mean, not snow, but the rain and thunder and lightning for like almost 2 months. And so I had to call city hall, which, I don't deal with the politics people like the mayor, but I did call the mayor office for him. And then I had to call 211, which I lived probably like 1,000 feet from where he was at with my sister. So I had to walk the phone back over there because 211 didn't want to hear from me. So I had to get him. And then they send the police. So, in my world, we don't deal with cops, because cops are not kind to us when they come in. I watched the police when I was younger beat up my brothers, both of my brothers. So I don't have no relationship with police, and the young man didn't want no assistance because they brought the cops. They said the only way we can help him, we got to bring the police there. So they did bring the police, and he didn't take the help. So, police is not welcome in this community here on Dixon Avenue side in New Haven. We rather deal with people, and because police are very aggressive to us. So not only that, but just even with my own family members, my own brother and my 2 kids are, having COVID-19. We can talk about that more, but I have watched literally probably 20 people die since 4 months now from COVID-19. Am I angry about it? Hell to the yeah. Thank you, Pauline.
And so maybe related to that, so you've been seeing people not only being angry and frustrated, but COVID hit you very close from home because several of your loved ones have been caught the virus. And so I was just thinking about how it is crazy that it's so not random that your loved one got the virus and that my loved ones haven't. But yeah, I was just wondering if you could talk a little bit about that. Yeah.
So my brother went to work. He is one of the essential people. I have quite a few people that's essential people in my family. And my brother had went in on a Thursday, which his supervisor had been out for like over 2.5 weeks. I kept mentioning to him, do you know what's going on with your supervisor? Because to me, it seems like she has COVID-19. No, she don't have it. And he told me, he said, well, they told me if someone in the halfway house catch it, he'll be the first to go because of his diabetes, severity diabetes he had. To make my story short, my brother left on a Thursday, called out Friday, and we had to rush my brother the week later he had passed out, couldn't walk, couldn't breathe, couldn't talk. And he didn't even remember how he got to the hospital. So during that time of that week of him leaving on that Thursday, my brother literally tried to call his doctor, but the doctors wouldn't let him in because they kept saying, you got to quarantine for 14 days. If my brother would have stayed out just 2 more days and then into the hospital, he would have been dead. Immediately as soon as he entered in there, they put him on that ventilator machine. And at that time, when they put him on the ventilator machine, we was hearing from a doctor every 3 or 4 days at a time. And my brother literally stayed in there probably 2.5 months. And he's a 56 black male. and the treatment that he got was so unbearable. It was so unhealthy. I just didn't understand how my brother didn't give up. But the reason why he didn't give up, because he couldn't dial the number, he couldn't walk, he couldn't dial the number he would help him dial the number, and they would put the phone through the ear, and we would start praising him and lifting him up, that he has to fight, he has to get up out of there, because we couldn't go in there. At one point, I wanted to go in there and just literally do wrong things and to enter the hospital so I can get my brother out of there, because the best person to take care of my brother is us. We love him, even though if the people didn't love him. But we understood the severity of COVID-19, because I know the essential workers was overwhelmed too, yeah, and they was tired. But a life is a life. We're supposed to always treat a life as if they're going to live, even though their time is running down. We still give them dignity before they close their eyes. And the doctor told us when we did talk to him that it's up to him if he wants to live. So in the meantime, as I'm trying to pray on my brother and lift my brother up, I didn't hear from my son, and I was worried. My son had been in prison at that time, like almost a year and a half, and I kept saying, he kept questioning me before he caught COVID-19 the first time. He kept saying, Mom, what are the symptoms of COVID? And I'm like, man, you don't watch the news in jail? He's like, man, other people have the TV, Mom, and sometimes I can't watch the TV, but I gave you money for a TV to make my story short. He kept calling me before COVID really hit about questions about COVID, and then I didn't hear from him for a week and a half. And one of my twins told me, Mom, my brother got COVID-19 in prison. I was like, what? I was like, you got to be kidding. He wouldn't say nothing to me. So when he finally called, once he got a little better, I said, yo, man, why you didn't tell me that you had COVID-19? He kept saying, Mom, God got me. I'm all right. I'm all right. I feel better now. So what was the symptoms that he had that he didn't go get help for was he lost taste buds, he slept 3 days straight, and he couldn't get up. He said he couldn't even take a shower. So I'm like, I can't tell him about my brother Jerome, and once my brother Jerome got well, I couldn't tell Jerome about him because I didn't want both of them to worry. So now I got two people that's catching COVID-19, and when you get it, again, I couldn't get in the hospital. So it was very traumatizing for us because literally we had reached out to people that was in California, people that was down south, and we formed a team. My sister formed a team to pray for my brother every morning at 8 in the morning and then at 8 at night so he can fight himself so we can fight for him, because when you can't pray for yourself, you need other people's prayers to lift you up. And that's what we did for my brother. And I didn't know I had to do it for my son. So I started just fasting. Because Pauline, to tell you one thing about me, when I ask for something, I got to give up something. So I started fasting for my son. So COVID-19 hasn't been really fair to my family. And hell no, it hasn't been fair to the community, because I lost a lot of people. We just buried one last Monday.
If I could just jump in for a second, I think, Bridgett, your stories they're so powerful, and one of the ways that I feel like your story does justice to us all is that when we were talking about violence, we hear about one side of the violence, right? We read it on the news, and we hear about what's happening in the cities. So, and that's one side of things. What you're bringing to our attention is another side of the violence that that we don't know about, and that is not being able to access the care that you need. When you do get care, not being treated with dignity. When you're out on the street being afraid of the police and not not having, anyone that you can call that you feel wouldn't hurt you, not being able to get food stamps, not being able to get stimulus checks. So those are all incredibly violent things, but we don't hear about them, and then we see, statistics that that violence is up. But what's the other side of that story? And I feel like you're laying that out for us in a very clear way. People are going through these violences all the time, and it feels like this situation has really brought things to an extreme where people are struggling to put food on the table, to pay their rent. So I feel like this is, you sharing your story has the power of really showing that other side of violence that we choose not to see. And I think that's very important. And another concern of mine is, so violence, is one thing that we see from one side only. And the other piece that is now coming up is that people are saying that we're going to have an epidemic of mental health problems after this whole COVID situation. So I also think that this is an important point where we're going to have to make a decision whether we're going to think that people are getting ill mentally because of the situation, or whether we're going to pay attention to the fact that people are on edge because they lost their job, because they lost income, because they can't put food on the table, because they don't have health insurance. And that's what's making people suffer to an extreme. And so this is going to be an important decision for us, I think, how we're going to choose to see this situation and how we're going to react to it.
Pauline, can I say this? I appreciate you, Anna, saying that, because it is so true. And I as you was talking, and I'm thinking, like, my niece lived next door from here, where I'm at, and the kid's grandmother had passed away. They sent her to Bridgett. As soon as my brother got out, because it took my brother about 3 months to get out. As soon as my brother got out, they didn't have nowhere for people to go, so they started shipping loved ones out of New Haven to Bridgett. And because she was up there in Bridgett, the lady lasted like 4 days to pass away. But what I'm telling you this story is for, because Mom had to go to work every day. She couldn't take off because she's that essential worker. There's a senior lady that she takes care of. The lady can't talk or walk, so she does everything for the lady. And so what I did was went over, and I couldn't be the mother, but I was the aunt / like grandmother, because they see me like a grandma because I'm so much older than their mom. And I was able to support the kids while Mom was at work, and then when Mom came in, she was able to fulfill her shoes. So again, the lady was sent to Bridgett, didn't have no family member to come in. She called one day before she went to get that defibrillator on her. She told my niece that, I'm so scared and I don't want to die by herself. She didn't want to die by herself, but she ended up dying by herself. And what I'm saying is that we can't even have a funeral for the people that pass away. And then even with my brother and it being so sick, when my brother was trying to tell him once he got off the defibrillator that he can swallow, nobody listened to my brother, because the defibrillator had him where he couldn't talk. So he would go like that, like trying to make sound. And as he was doing that, so they just told him, try to write. He couldn't even write. So he was saying to them, can you just give me something to eat? They never fed my brother for a whole month after coming out the hospital. I mean, after the defibrillator, after that where they watch you all the time. Oh, Jesus, what is that? It's not oh, Jesus. Wherever they watch you when you have a surgery, after he came out of there, he didn't eat for a whole month. And he couldn't talk, so he couldn't really express that I can eat until a young black doctor came in and he said, Miss, can you just please try to hear me? Can you come closer? Can you hear what I'm saying? I could swallow. And it took him 30 days to be able to express that, but it took the young black doctor to hear that he can eat. And then he had to prove to her that he could swallow. And once he did that, they said change the order. But why did it have to wait for my brother to almost starve to death before he get his needs met? My sister sitting right here, Anna, she had fluid on both lungs. They won't let us come into the hospital because the media just keeps saying it's the black and brown people that has the high rate of COVID-19. So when we walk down the street, people are crossing the street. I don't have a problem with that because I'm older, right? I'm 58 years old. To me, I'm saying that's their ignorance. They don't really know me. But if you want to be safe, I don't have a problem you being safe because I want you to keep me safe too. But it's not just the black and brown people that have it. But it's a lot of the black and brown people that are essential workers and are taking care of the non-black people. And I had a niece that wouldn't go in the hospital and work. She took a whole month because she said everybody, when it first hit, came out with COVID-19. They was all seniors and they was all white. She said, Bridgett, I don't mind taking care of all the white people, but I want to take care of some of my people too. So she took off for a whole month at Yale Hospital. Again, no, I'm talking too much. I'm quit, Pauline.
No, when I listen to you there, I just, yeah, there, as Anna was saying, there's so much violence first, and then everything is, you know, like there are obstacles after obstacles after obstacles after obstacles. They're like, it's never simple. It's never simple. It's very often scary. Yeah, there is a lot of violence, and since it is a webinar on lived experience, and Anna has also life experience, but like a different one, a more privileged one. Let's say that. I was just curious, Anna, if you could talk a little bit about what's been your experience getting access to treatment since the beginning of the pandemic, or just your experience with the health system and the pros and the cons and the obstacles that you also probably met as a foreigner, but maybe with less. Yeah, I'll let you.
Yeah, thanks, Pauline. I guess I should acknowledge that I'm incredibly privileged. One of the things is that I have health insurance. That's already not the reality for a lot of people in this country, and so I never had to worry about whether I'd be able to get medical care or not in case I need it. So that's not a worry that crosses my mind. And I can only imagine someone being sick and vulnerable, and on top of that, having to worry whether they're going to get a bill after they go to the emergency room or after they need a hospitalization. So I never had to deal with that. What did happen is that, as Bridgett was mentioning, a lot of the services that you could normally get in a hospital were paused because hospitals were overwhelmed with COVID. So a lot of my care was put on hold. So I couldn't really get the tests that I badly needed to diagnose my condition and then start treatment. So that is something that happened, but that's way more related to the fact that the system wasn't well prepared to receive, the amount of cases that we got right away. It took us a while to understand that masks were important. There was a lot of controversy around whether people should be wearing masks or not, so we took some time to adjust to that. And even though Connecticut, I feel, which is the state I live, did a great job with educating people and putting some lockdown and shelter-in-place measures that I feel have made an incredible difference in the state, still the system was overwhelmed early on. So for me, my treatment was completely paused for a while. And then something that I experienced myself that for me was very new and very difficult to deal with is that a couple of months ago, the United States closed the borders to Brazil, which is my home country, and it's where my entire family lives. And when that happened, I realized that I had no option to go back to my country if I needed to. I could get into my country, but I probably wouldn't be able to come back to the U.S. for my work. So this has put me in a situation that I never thought I'd see myself in, where I'm kind of stranded in a country that is not my own, and my family is not here. I think they're doing well, but the country as a whole is doing very badly. And so this is a completely bizarre situation to me, and I have a very hard time making sense of it. I really wish I could see my parents and my brother and my sister and all my friends and make sure that they're okay, and I can't really do that. So additionally, I'm here on a visa, and Pauline, you're not a citizen in this country either, and we had a series of situations where it looked like our visas were either going to be canceled. There was talk about, not being able to stay in the country if your activities were all online. So we just had a series of uncertainties added to the already very uncertain reality that we're all going through. And so I'd say that on the one hand, I have a lot of privilege, and then on the other, as a foreigner and a South American person, there's this whole other side that I can't really make sense of very well.
And do you think that, at least for me, I think it really helped, just the going back home before the pandemic and having to redo my visa with always more difficulty. It's something that I've experienced, and it's like an increased amount of stress with that gave me or like now we're like in a situation of very high insecurity, and like a tweet basically can put us out. It's a little bit like maybe a bit too much to say that, but it's not, we are not that far from that. And so I was just wondering to continue with you, Anna, if you think that going through these experiences, both because we're talking about live experience, do you think that it's just getting sick in a place that is not yours, getting seriously sick, not knowing what was going on with you for a long time, and then now this pandemic where you're very far from home, at the same time with like the fear that you're going to be sent back home without your consent, do you think that it has helped you, I don't know, like just, like I know that for me, it has helped me, at least I think, to be in a position where I was a bit more able to listen, I think. I don't know if, I don't know what you think about that. I was wondering about,
Yeah, I mean, that's a good question. I don't think you're ever prepared for these kinds of things, and I also acknowledge that there are experiences that are way more dramatic than the ones that I'm going through. I didn't lose my job, and even though I didn't get a stimulus check, I'm not unemployed. So I think that I have a lot of kind of safety nets in place with the health insurance and everything. So I acknowledge that very much. What I hadn't experienced before, and I guess experienced in a very intense way, was the fear of dying, which I think we all have at points in our life. and maybe sometimes that's more present and sometimes it's kind of in the background. But I don't think I ever felt it at close to me. And I think that these series of violences, and I'm calling them that, Bridgett talked about a bunch of them. It's just one on top of the other, right? And then, you know, people, I felt like reaching breaking point several times. And I've had mental health challenges in the past as a child. And I think that has always been with me, a fear of maybe falling back to those experiences that are very disruptive to life and very disorganizing. So I don't know, I just keep thinking that, you know, things are compounding. And I wonder, you know, when are we going to say that, or start saying that we shouldn't be coping with these things, so that things should look different for us? I think I've been very bothered by this language of coping. You have to learn how to cope. Some things I don't think we should cope with at all. Most of the things that Bridgett was talking about, I feel like no one should go through that ever.
I'm just cutting you here because I was really surprised yesterday when we were working at preparing the presentation. Something you said, Bridgett, and that you say very often, and it's kind of crazy when I think about it, because you now have a good job at Perch. You have a good job, and that you live in poverty. You keep living in poverty. Yeah, and so what it, like, yeah. So I was just thinking about that when and how do you cope? Like, do you have to cope with like, do you have to do self-care? Do you have to like do meditation? Do you have to even when you're like have a full-time job for 10 years at Yale, and it's not the fault of Yale. Like, I mean, it's the fault that you never have a break, and that you have like so many things that you have to pay all the time, for many different reasons, or that you don't feel comfortable living, like that it's so hard for you to change a neighborhood for one reason or another. It's like all these things that kind of like keeps you keeps you, I don't know, keeps you down or keeps you back. And you've worked so hard. You work so hard, and you keep working so hard.
I think it's just the passion in me, just liking and loving people, Pauline. But because of, excuse me for cussing, but because of I change, I can't expect for other people to change. And every time we rise and we go to different levels, it brings different devils, right? So more stuff happens. The more money you make, the more bills you got to pay. I've been broke, been poor so long, it became a culture. So when you get out the sand of being financially in debt, and you start moving up, because I've been poor so long, I still feel like I'm in debt. Like, I know I got better insurance than I ever had in my life, because I didn't have insurance until I started working full-time with Yale, like, right? So, but in my mind, I feel like I still don't have insurance because I've been without insurance so long. So it's a process. It's a process for me to be able to go and go to an appointment, right? Because before, when I used to go to an appointment, I didn't go to the appointment because I didn't have the money to pay for it. Or I would go there and lie and say I have insurance, and then the people will find out, and I get embarrassed and I'll leave. So all these new changes that's happening for me with the job, it still keep me in the bondage that I don't have it. Because as I'm climbing, moving forward, and see the people that I work with still down there, I got to bring them with me. So we got to climb together. Because it's no fun if I go in the store and buy a soda and they can't. I don't want to buy the soda for them. I want them to buy the soda for themselves. I want people to be able to stand on their own feet and make their own decisions. I don't save people. They save themselves.
That's so powerful, Bridgett. And I just wanted to acknowledge that some of the things that you're talking about are resonating a lot with people who are watching us today. And there were a couple of comments about, the importance to have health professionals of color taking care of persons of color, and you lived that in such an extreme way because it took a doctor who was Black to kind of start taking care of your brother. And so whenever people, wonder if, do we need diversity really in the health profession, I think you just give a perfect example of why that's important. And this has resonated with a lot of people here on the chat. I wonder if you could talk a little bit more about that.
Yeah, because if I go to the ER, if I go to a doctor, I want to see somebody that looks like me. Because, for one, I've been in the street since I was 11. I tell you, I was a heroin user for 13, 14 straight years. I've been clean off of heroin since 1991. So the doctors I never went to, even when I was pregnant with my twins, I didn't go to a doctor until I was 8 months because I was so much into the street. But I need the person to look like me because I have a Ph.D. in lived experience. For you, Anna, and Grousey have a Ph.D. in academia, whatever field that you're in, but I have a Ph.D. in lived experience, and my experience tells me that when I enter somewhere I don't know or I don't feel safe, I'm not going to go. That's for one. And two, I really lost my thought, Pauline. What was the question? I'm sorry.
It was about having providers of color.
Okay. So when I enter in there, I don't want to have to, thank you for sharing that. I don't want to have to break down my language barrier because I talk with some hip-hop, with some slang. So when I go in there, and if I don't have a doctor that looks like me that can understand my language, then every time I go to talk, I'm going to have to stop and break down what I'm saying to a doctor. That's frustrating. So it's important to have culturally people that looks like you when you enter services or in the hospital. Sorry,
yeah, I remember Bridgett. Yeah, I remember Bridgett something that maybe it's not related to COVID, but I think it is to some extent because it also is linked to probably how people access care now, and it's part of our job when we were co-directing the Citizens Project was to recruit people in the community. And the first time that I was going around with you, I was just having an hard time. I was like, why are you being so guarded when we enter the agencies? I was like, just make an effort, almost. And it really took me a long time to kind of understand how crazy, how racist it was, to say it. Just that it never passed through my mind the fact that that there was a reason why you were scared to enter some of the agencies, for instance, or why you were guarded when there was a security with some people wearing a gun, or and I guess that to go back to COVID, how then you can ask people to listen to the government or to get access to care properly, or when you've been mistreated as much for so long. and that literally just the view of it, like just how long it took me to understand that the view of it, like seeing like the entry of certain agencies just make you sweat. You're scared. You're just scared to go. And that's crazy when you think that that's supposed to be places where people are supposed to feel safe. Yeah.
So I don't think if I'm going to get services that we don't need I don't need a cop with a Glock on the side of his hip. I don't need to be have a metal detector when I enter, because a lot of times your staff, they don't do that to the staff. They do it to the people that they work with, right? But the staff is just like us. We are all human beings. So I think fairness across the board, Pauline, if the agency is going to have a gun and have a security at the door, it should be for all, not just for the people you work with. It should be for staff and the people. We want to treat everybody across the board the same.
But the fact is that I was not scared and you were. You see what I mean?
But you didn't have the police raid
like
your house.
Yeah. That's what I'm saying. It's what I'm trying to. We were talking about the contrast. It's exactly that.
So, when police raid up the house quite a few times when I was out there in the world. It's very scary to have 40 people come in with guns and point them at you. So that traumatized me for a long time. That's probably one of the reasons why I don't socialize with police, too, because of how they disrespect your house when they come in, kicking the door in. At that time, I just had my twins, and they was trying to lock me up. I just had it recently, one like a couple of years ago with my son, brought my son down with that Glock to his head like that. That could have went off, and it wasn't even the son that you was looking for. So a lot of my experiences traumatized me from dealing with the police or really going into an agency, because to me, I feel like I shouldn't even have to go into an agency. I put the flyer up in the agency. The students can call themselves. I don't need a leader to call for a student, because that's not what we do, right? We have them call, so this is voluntary, right? So a lot of times I go into the agency, they stop me at the door as if I'm a drug dealer, and I can't get in because of the color of my skin. But if you knock on that door, they'll let you in with no problem, which I don't have a problem with that either, right, Pauline? Because a lot of people are just lack of education when it comes to racism or, I can say this. We teach people how to treat us, right? So if you was taught in your home about racism, then eventually you'll probably come out to be a racist. But that's not what I was taught in my home. I love people, and I want to get this out. I don't know how long we have to be up here, but I also want to mention about my son that was in prison. He had COVID-19 again. He caught COVID-19 again in prison. And then they came past Monday and took some plasma so he can save somebody else that has COVID-19. So that kind of experience, how the police is just violating my son's right, how my experience of how they beat it up my sons, they beat up my brothers and violate my son the way they are. I don't disrespect cops. I was with you yesterday, and I told you, I said something to that cop. In 58 years, that was the first time I ever said something to a police. I don't talk to police. But it felt good because I was out of my element. I did something different, and maybe that can be the door to open up for me. Even if I don't build a relationship with them, at least I can start a conversation with them.
I just wanted to offer a quick comment about what you just said, Bridgett. there's a long history of not requesting permission to people of color to, manipulate their bodies and use them. There's such a lengthy history of that, and the fact that this continues to happen, that your son was not aware that he was getting his plasma taken to save someone else's life. And that's kind of like along the same lines of what you were saying before of your family member who's a person of color but is taking care of white people. And so like this just idea of, how you can treat bodies in different ways. I think this is such a glaring example of how pervasive racism still is, and that we're nowhere near where we should be in that respect. And I just, again, I have to thank you for your how powerful it is when you share these stories, because that really brings it home to all of us who may think that we're doing enormous progress. It shows that we have a lot of work to do. We're not there yet. This continues to happen. I just wanted to add that.
Yeah, I've just wanted to second that. I've worked every day almost for the past 3 years, for 3 years with Bridgett. And yeah, I'm definitely not done. Let's say that. Yeah, definitely not done. And it's so easy to forget. I think, yeah, like there is something about how it is easy from it's one of the things that like how it is easy for me to forget, because I just have to go back home and go on weekend, kind of, and all of a sudden there is no, I don't see that anymore. Like even if I like go back from work and I've seen very difficult things, we have clients that are going through a very tough patch, and I know that at home things are not the easiest because it happens. Not that it is always easy for me either, because I've had my own demands and I have my own struggles. But it kind of feels again that the context around me makes it smoother, makes it easier for me to deal with these problems. That again, I don't have all these obstacles and all these things that keep me behind. Yeah. So just, thank you for your friendship, Bridgett.
And the other piece that I wanted to highlight, I guess, and something that always strikes me when Bridgett talks about it, is that there's the stories of hardship and of violence, but you give so much back to your community, to your family. You're doing that right now, but you're taking time off of your life to talk with us, to be in this webinar with us. And I just wonder where does that come from, like this ability to give back and need to give back that you have and that your life is based on. I find that wonderful, and I think that we have a lot to learn from you regarding that. I wonder if you could, say something about that.
I just think is the work that I'm doing is just the right thing to do. So COVID-19 came out. A lady was in the hospital for a checkup. She was on a walker. She had to be about 70, to tell you the truth, had to be about 70, 75. Her daughter brought her to the doctor, but her daughter was running around in the cafeteria trying to get her something to eat. each. But her mother already got what she wanted, and the daughter stepped out line and tried to get something for herself. So I was the next person in line. The mom said that to go ahead, and I was like, okay, no problem. I went in front of her. I paid for my stuff. I paid for a white lady, said that's 75 years old. I paid for her stuff while her daughter was still searching for something for herself. So I said, I'm going to pay for her groceries, and the daughter can, just fend for herself. So I did that. The lady turned around. She's like, me? You paid for me? And put her hand over her mouth, but the daughter ran over there. Mom, what are you doing? I was like, oh man, maybe the lady will think I did something to her mother. And I was like, no, I didn't do anything. I was trying to explain to her I didn't upset her mother or anything. So she flew back over there as if I did something. I was like, the mom's like, no. This young, nice, girl, she did call me girl. This young, nice girl paid for my stuff. And the daughter looked at her like, what? You pay for my mother's stuff. I was like, oh, am I going to get killed for paying for this lady's stuff? I just thought it was the right thing to do. And so the mother, like, you just give me a kiss right here on my cheeks. I'm looking at her. I'm like, this is an older white lady that's telling me to put my black lips on her cheeks. I was like, I'm going to smack her cheeks like as if she was my mother. Mwah! And I did it just like, I didn't have it. Think about it. I was like, well, I don't know if she want my lips on her cheeks, and my lips are kind of big, but I kissed her like she was my grandmother. And her daughter's like, you kidding me? You paid for that? She said, Miss, you are going to be blessed. You're going to go along with, saying all this. I just, walked away because I have Pauline in the car, and I'm like, why did her daughter make a big thing that I paid for her mom groceries for one? Two, it was the right thing for me to do. This lady looked like she was coming out of somewhere, like a cancer side of the hospital. Like she just needed something else besides her daughter, and I was the something else that put a spice to that. So what I do, literally, I'm a walk and breathe person to lift somebody else up, because there's so many people in our communities that are hopeless, and I'm there to give them hope and to help them be hopeful. That's what I do, Anna, and I do it day in and day out, not just for the people I work with, but for everyone in my family and everyone in the community where I stay at.
Thank you, Bridgett. I'm noticing it's three or four. Anna, do you want to maybe add something before we start the questions? So you should we just let it at that, on that note of hope?
I think that's a great note.
Open up for questions. Yeah, I agree with you.
Yep. And the chat is super vibrant. It's so nice that people are participating. It looks like it's a lot of what we're talking about is resonating with folks. I'm so happy about that. But yeah, let's go over the chat and start engaging with folks who are listening to us.
There was maybe first, before everything else, we forgot closed captioning and interpreter services, and so I just wanted to apologize for that. And it is true, disability access is really a social justice issue, and it's the kind of things that if we were having a bit more space for that also, we would all be better off. It's something that we need to remember. And another thing that maybe, Bridgett, you might want to talk a little bit about that, and from what you've observed in the community, but Anna, you're also free to jump in, is People have been asking about the increase of setbacks of persons in recovery from alcohol and substance abuse is happening, and we were talking about that yesterday in the car, and you were mentioning that people are using, like, that it's what, like, that people are struggling right now. Yeah. So I don't know if you want to say a few words about that, and Anna, if you want to jump in.
So, yes, me and Pauline, yes, we got together, and last weekend they had a memorial for a young man that passed away like 6 years ago, between 6 to 8 years ago, and it was 7 shootings that night, and one man died that was a boxer. Then we turned around and had the young boy got a headshot, died right with shot in the head, and a 17-year-old just OD'd off of the parents' medication. I don't know if it was methadone or fentanyl, but the violence is rising up because, again, we are still told that we can't really go nowhere too much. We still are told you got to wear a mask. Half of these people around here don't even have masks. Even the people that's doing essential work, my niece is in the hospital, they want her to wear one mask all day and go into different rooms. So it's still a shortage. I mean, people are hungry. I'm hungry. I'm talking about with food because I don't have transportation to go out there to the stores. People are tight, and they keep saying, you don't got to pay your rent now. You don't got to do none of that. My landlord said he wants his money day in and day of each month. They said, don't listen to what that meter say. You pay your rent. You pay your bills. So people are pressed. They don't have their job. The food stamps are not making ends meet because the kids are in the house 24/7. They're not in school. They're not in no camp or anything. So more money is being put out, more food is being eaten, and people are struggling every day trying to figure out should they buy food or pay the bills, should they buy food or get their medication. You got to do either or. So what do? We do anything necessary to feed our family. That's what my culture is about. I'm going to do what I got to do to take care of mine. So if it means to go out and break bread and hurt somebody because they don't see no way, that's what they're going to do. If we can come out and give more hugs than drugs, I think our community would be a better community. And if we can give out and let people know that we understand the struggle is not by themselves, the struggle is with us too, because to make us all work, we got to all unite. Whether we black, brown, white, whoever we are, we all got to unite together. That's what makes this country run. Not one color, not Trump. It's all of us together. I feel like if we all end this together. And I am hopeful that this too shall pass, because this is only temporarily. We always have life interruptions, right? It's what we do with the life interruptions. I'm going to continue staying hopeful, and I'm going to continue climbing. And as I climb, I'm going to bring anybody and everybody with me. Thank you.
I'm just wondering if some of the,
yeah.
Sure. I'm also wondering if some of these difficulties that persons in recovery from alcohol and substance abuse or use are facing are also related to the very things that we were talking about before. So let's say you're on methadone treatment. You have to go every day to get it. I know that there were some waivers that people could get it for a week, and some of the rules changed, but still, if you don't have your own car, that means you're going to get exposed every day. Can you imagine how much that increases the chances of you getting COVID if you have to go every single day to get a medication? So I think that there's so many things that overlap in that if you need very intensive care with your recovery, recovery, you're going to get more exposed. And so I think that these things overlap a lot, and we sometimes fail to see where they do. And I think that we often don't respond quickly enough to make changes to make sure that people continue their recovery journey without that meaning that they have to get exposed in order to do so. So I think that we're talking about like the same problems overlapping.
I was wondering about also something that you often talk about, Bridgett, is just that it's moments like that where where people don't get their needs met and they don't get access for services, or there is no services anymore. Sometimes that groups have been suspended. That basically that's these moments like that where people should have more access to services, and so what people are going to do, they're gonna relapse, right? Because it's so much of a like an everyday struggle. I don't know what you think about, Bridgett, but it's yeah, like basically when people are like, it's hard enough like that, but when on the top of that they don't get the support and the help that they're usually getting, it makes things even harder. And things are so uncertain and scary for everybody. So for people that have, I don't know. Yeah, I don't know what you think about that.
So Pauline, because I'm a little older, right, in my experiences, I don't got no mother and father. Like, my mother had, 5 girls, 5 boys, and I only got 2 sisters and 1 brother. I lost most of them for addiction. So I got to know how to survive without them. Like, he always put other people in your path when you have a void missing, but it's nothing like your own family, them, right? The survival skills kick in. I know whatever that I'm experiencing right now, again, it's only temporary, because I'm not on heroin no more. I'm not on coke no more. So, I'm not out here running cells out here. So if he changed me from that life 20 years ago, 30 years ago, this COVID-19 that we're experiencing now, he damn sure can help us with that, with this. I am a believer. I have faith. And I got to hold on to that. I have to hold on to that. And another thing, what I do is I model what hopeful look like, because I spit it all the time. I talk about it all the time. I breathe it, eat it, chew it up. I am who I am. So if a life interruption comes, Pauline, I know this too hurdle. I can climb over. I don't have to go self-medicate. And I have the victory of COVID-19. I believe that. And I don't gave my phone to people out here that's homeless. And then I didn't even wipe the phone off. I just jumped right on the phone. Am I taking a risk? Shit, I was taking a risk when I was running around and doing all that dope. I should have been dead back then. I have life today, so I'm going to live it to the fullest and try to pass it to somebody else so they can live to the fullest. I don't have no fear. Fear ain't going to sit in my house. Not from COVID. I can't see what this chat is, what they chat. But I don't know whoever's child is. I can't see none of the chats because my eyesight ain't good. But man, he's like, so, I don't know. He's like, I would love to hit what he's talking about.
Do you wanna jump in? And I think you've been following much better than I did. It's hard for me to.
I can't see.
I'm not used to it.
Oh.
Yes, sure. So, Bridgett, the first, there's, many people resonating or like talking directly to the experiences that you mentioned. Someone said, Bridgett, your experience and testimony is such a blessing. Thank you for shedding light on the injustices of our system in America. May God continue to bless you. So a lot of people are really are thanking you for sharing your powerful stories. I think there's one interesting comment here about cultural competence and cultural humility and how they're not the same thing. And I think that's an important point, and thanks for bringing that up to us. And then someone also, when you were talking, Bridgett, about if you're going to a mental health agency and there's someone with a gun right at the door and there's a metal detector, why is it that some people have to go through and others don't? Like, what kind of message does that send? And someone really resonated with that and said, yes, if screening is needed, screen everyone. And then this, Bonnie provides another example, just like in hospitals where Black parents routinely get a drug test after giving birth, but white parents don't. And so in many ways, there are many structures within the system that remain unchanged and continue to be unjust and provide unequal treatment to people. So a lot of folks are just resonating much of what you said, Bridgett.
Okay. I thank him so much, and I don't know how to thank him, but I thank him so much. But I also want them to know that when you're in the presence of anyone that comes into their space, you never want the person to feel like it's you and then it's me. It's not us and them. We together. Relationship building is so important because you make a person feel like you care, even if you don't. But give them that undivided attention, because a lot of times they don't get it at home. So when I enter to a facility, I want to be able to get that. Then I know you're paying attention, and I know I can lobby for myself or what I want, and then we can build from there on. But it's so important to not to have a person thinking like it's us and them, or, we need to really start shifting some of the power, because leaders and doctors have power, whether they know it or not. You have the power, and we listen to what you say, but we also need you to listen to what we say. It's important.
Okay, so thank you, Bridgett. So it's 3:10, so we're gonna have to move on. Final comments. I don't know, Anna, if you want to share a few things before closing.
Sure. I just wanted to thank everyone who joined this webinar today. The fact that there's so many people, I can't really see the number, but I'm sure I can see that it's a lot of names and people were very active in the chat. I just wanted to, I think the fact that we have many people with us today means that people are really interested in this topic, and that, that's one step in a good direction, I think. And I also wanted to thank, Bridgett, I'm usually speechless after I hear you, and I remain that way. Your stories are so powerful and so inspiring. I think that when you say you have a Ph.D. on lived experience, I feel like that's the type of Ph.D. that I wish I could have gotten, and not this academic one didn't teach me all that much. I'm so happy to be able to learn from you, and so thankful that you were able to join us today and be part of this project. So, and Pauline, you were an amazing facilitator today. Thanks so much for, you were just wonderful. This was a very, to me, a very moving conversation about a difficult topic. So I just wanted to say thanks, and thanks to Graziella, who's been helping organize all of this with us, to Larry, who's our director, to Maria Restrepo-Toro, who's the co-director of the MHTTC, and to everyone that was involved, and to Bina that provided technical assistance today. So that's, I just wanted to thank everyone for that.
Yes, thank you all. Thank you so much. How powerful and wonderful conversation we had today. And I also want to let you know that next Friday, this conversation will continue. If you like, please come back and share it with your friends and share it with people that you think will, enjoy and come and share the experience and engage in this conversation. Was so much a pleasure to see how wonderful this conversation, and thank you everybody. So thank you, Bridgett, and thank you, Anna and Pauline. You did an excellent facilitator today, so I'm so glad to see that. I would like just share with you our next events from MHTTC. So next week at 2 p.m., we will be here again with Anna and more two guests. Anna, can you please share a little bit so who will be here next week?
Yes, so next week will be the third webinar of the series of webinars that we've been doing about lived experience and COVID-19. So for next week, we're going to talk about the importance of peer work and peer support. So we're going to have an amazing group of people talking about that. Our panelists will be Karis Myrick, Thomas Wexler, and Richard Ewens. And so I invite you to join us, because that's going to be a very exciting conversation as well.
If you want to watch this roundtable again, please go to our webpage, www.mhtccnetwork.org/New England. We also have our first roundtable about the same topic with different speakers. It is available. Please answer the survey. Your feedback matters, and you want to hear from you how you can continue to provide education. And on Monday, August 24th, this roundtable will be available at our page. So thank you very much, and I hope to see you here next week. Thank you.